Good afternoon, Professor. This is Francis Fleury. Today is April 26, 2015, and this is my video presentation on complementary and alternative medicine. Now, here are my notes on complementary and alternative medicine. Complementary and alternative medicine is a category of medicine that includes a variety of treatment approaches that fall outside of the realm of conventional medicine. An increasing amount of research is being done to establish the efficacy and safety of alternative medicine. But compared with traditional Western therapies, such as drugs, research on alternative medicine is still quite limited. Now, what is the difference between complementary and alternative medicine? The difference between the two is highly important to be understood. So, complementary medicine refers to practices and products that work in conjunction with traditional medicine. For example, a cancer patient who undergoes acupuncture to help manage her side effects such as vomiting and nausea. And alternative medicine differs in that it is not used as a complement to, but rather as a substitute for traditional therapy. An example would be a cancer patient who forgoes recommended chemotherapy and instead chooses to treat the disease with specific dietary changes. I don't know, maybe instead of eating pizza, they might eat like fruits and vegetables, or instead of eating salt, maybe they would replace the salt with other milder spices or anything of such. Now, there is a third category that often gets lumped in with conventional and alternative medicine. This medicine is called integrative medicine. Integrative medicine draws from both complementary medicine and alternative medicine and combines with traditional Western therapies, says Donald Abrahams, medical doctor, director of clinical programs for the Osher Center for Integrative Medicine at the University of California, San Francisco. Now, who's using complementary and alternative medicine? Well, quite a lot of people are using these medicines. The National Center for Complementary and Alternative Medicine recently surveyed Americans on their use of complementary and alternative medicine. The survey, which gathered information from more than 20,000 adults and nearly 10,000 children, found that about 40% of adults and 12% of children use some form of complementary and alternative medicine. That's actually a high percentage, but maybe whatnot lower than normal. But women, people ages 40 to 60, and adults with higher levels of education and income tend to use complementary and alternative therapies more frequently. So, more low-income families or who have, cancer, they're least likely to use complementary and alternative medicine because they're unable to pay for it. Now, other forms of complementary and alternative medicine may be um, yoga or exercising or meditation, acupuncture, or massage therapy. Now, all of these tend to have a good effect on the body. Therefore, having helps to alleviate maybe the symptoms of cancer by relaxing the muscles or relaxing the tension coming from any stress. So therefore, massage therapy or yoga is a really good way to help in alleviating the symptoms of cancer. Now, what are the categories of complementary and alternative medicine? Well, according to the National Center for Complementary and Alternative Medicine, recognized are five main categories of complementary and alternative medicine. The first one is mind-body medicine. Mind-body medicine includes treatments that focus on how our mental and emotional status interacts and affects the body's ability. The second is whole medical systems. This category refers to comparing complete systems of medical theory and practice, many of which go back thousands of years prior. Um, the second, or the third, excuse me, is manipulative and body-based practices. This relying on the physical manipulation of the body, this practice is intended to improve specific symptoms and overall health. Examples of these would be chiropractic or osteopathy. Now, the fourth type is energy medicine. Now, this form of alternative medicine uses energy fields to promote healing. Now, that sounds really good. Biofield therapies affect energy fields that are said to encircle the human body. Forms include Reiki and Qigong. Bioelectromagnetic-based therapies such as magnetic therapy involve manipulation of electromagnetic fields. Now the final, which is the fifth, is biologically based practices. Since the focus is on herbs and nutrition and vitamins or anything that helps the body to to maybe um, digest more easily. Now, a growing interest in these kinds to 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 conclude, a growing interest is in these kinds of therapies is leading to more research. But many of these biologically based practices have yet to be thoroughly tested. Now, Professor, this was my video on complementary and alternative medicine. I hope you enjoy it. Bye.